When we think about labor and birth, we often picture this intense physical event, but it's so much more than that. It's actually this complex, incredible dance between a mother and her baby, a perfectly timed symphony of hormones and mechanics. Today, we're going to break down this amazing process step by step. So, let's get right into it. We're about to go on an incredible journey into the world of labor and birth, and trust me, it is fascinating. All right, so what flips the switch? What tells the body, okay, it's time? Well, it's not just one thing. It's actually a complex dialogue, a back and forth conversation between the mother's body and the fetus that signals it's time to begin. And here are the two sides of that conversation. On the maternal side, the uterine muscles stretch to their absolute limit. Then you've got this crucial hormonal shift. Estrogen goes up, progesterone pulls back. And on the fetal side, the baby produces more cortisol, which helps kickstart the whole process. When these things happen together, they fire up the contractions, which are really the engine of labor. Now, before the main event, the body starts sending out some pretty clear signals. We call these premonitory signs. Lightning, for example, is when the fetus drops down into the pelvis. It's a huge relief, actually, because you can suddenly breathe a little easier. Then there are Braxton Hicks contractions. Think of them like practice runs. You might also notice some cervical changes, lose your mucus plug, or get this sudden, powerful burst of nesting energy. It's this almost primal urge to get your home ready for the new arrival. Okay, for a vaginal birth to happen successfully, 5 critical elements have to work together in perfect harmony. We call them the 5 Ps. Understanding these 5 players is really the key to understanding this entire journey. First up, we have power. This is a 2-part engine. Part 1 is the involuntary uterine contractions that do all the heavy lifting of dilating the cervix. They're like these powerful waves that build and recede. And later, Part 2 is the voluntary pushing from the mother during the second stage. It's this combination that drives the whole process forward. Next up is the passageway. This is the path the baby has to travel, so the mother's bony pelvis and all the soft tissues. The shape and size of the pelvis are super important, which is why a wider, more rounded shape, like the common gynecoid type, can make things a bit smoother. But the body is incredibly adaptable, and those soft tissues, they're designed to stretch. The third P is the passenger, and that's the fetus, of course. Its size, which part enters the pelvis first, we call that presentation, and its position can all totally change how labor progresses. What's amazing is that the fetal head is actually designed to mold or change its shape slightly. It's a remarkable feat of natural engineering that lets it navigate such a tight passage. Then we have position, and this refers to the mother's posture. Frequently changing positions, walking, rocking, squatting. It's so much more than just getting comfortable. You're actually using gravity to your advantage. It can make contractions more effective, help the baby get into the best possible position, and just keep labor moving. It's all about working with your body, not against it. And finally, we have psyche, which is so important. High levels of anxiety and stress can release hormones that can physically slow labor down. They can directly interfere with the power we just talked about. This is exactly why the support of a partner, a doula, or a great nurse is so powerful. Providing information, reassurance, and patient-centered care makes a real physiological difference. Okay, so now that we've met the 5 key players, let's see how they all come together for the main event, the 4 distinct stages of the journey. This timeline gives us a great bird's-eye view. Stage 1 is the marathon. It's the longest part, where contractions gradually open the cervix. Stage 2 is the birth of the baby, a moment of just incredible effort and even more incredible reward. Stage 3 is the delivery of the placenta, the final act of the birth itself. And Stage 4, that's the critical immediate recovery period, a time for bonding and for rest. And this table breaks it down even further. You can really see what's happening in each stage. Look at how the cervix goes from 0 to 10 centimeters in Stage 1, how the contractions get more frequent and intense, and the typical length of each phase. It's like a clear roadmap of the entire journey, from the very first twinge to the final push. This slide is so cool because it shows that the baby is an active participant in all of this. These are the 7 specific cardinal movements the fetus makes to navigate the birth canal. It's this incredibly precise sequence of turns and flexes. First is engagement, when the baby's head settles into the pelvis. Then comes descent, that steady downward journey. Next is flexion, where the baby tucks its chin to its chest to make the smallest possible diameter. This is followed by internal rotation, where the head turns to fit the shape of the pelvis. Then comes extension, as the head passes under the pubic bone. After the head is out, we see external rotation, where the head turns to line up with the shoulders, which are delivered next during the final movement, expulsion. Throughout this entire amazing journey, the nurse really acts as a guide and a guardian. They're performing chi assessments, like constantly monitoring the fetal heart rate to make sure everything looks good for both mother and baby, and they're providing that essential continuous support. This slide shows a classic, incredible nursing skill called Leopold's maneuvers. It's a systematic, four-step way for the nurse to figure out the baby's position without any invasive tools at all. It's all done by feel. In the first maneuver, they feel the top of the uterus. In a second, they feel the sides to find the baby's back. The third figures out what part is down low, and the fourth assesses how far the baby has descended. It's just a perfect example of skilled, hands-on care. A really important nursing assessment is telling the difference between true labor and false labor. As you can see here, true labor means contractions that get stronger, closer together, and are actually causing the cervix to change. False labor contractions are irregular and just don't progress. A good rule of thumb, if you can walk, talk, and laugh through your contractions, it's probably false labor. But if you have to stop what you're doing and really breathe through them, and they're coming in a regular pattern, it's very likely the real deal. So what happens when the water breaks? The nurse's very first action is to check the fetal heart rate. They're making sure there are no signs of distress from something called a cord prolapse. It's rare, but is a serious complication. Then they check the fluid's color and odor and confirm the rupture using a few different tests, like amniture, or by looking for this beautiful fern-like pattern that amniotic fluid makes when it dries on a microscope slide. During birth, tears can sometimes happen. This table defines the 4 degrees of perineal lacerations. They range from a first-degree tear, which just involves the skin, to a more extensive 4th-degree tear that goes into the rectal mucosa. The most important thing to remember here is that these are common and that your healthcare provider will be right there to help you heal. So, how do you manage the sheer intensity of labor? Well, the great news is that there are many, many options available, from the totally holistic to the medical, and really the choice is entirely up to you. This slide lays out the 2 main categories really well. On one side, you've got non-pharmacological methods like patterned breathing, massage, and changing positions. These methods can help you feel more in control and can be incredibly empowering. On the other side, you have pharmacological interventions like analgesia or an epidural, which can provide significant pain relief, allowing you to rest and conserve your energy. And here we can see a breakdown of some common medications, from IV opioids like fentanyl to a regional epidural block. A huge part of the nursing role here is managing any side effects, like maternal hypotension. That's a sudden drop in blood pressure, which can happen after an epidural. And because that drop can affect blood flow to the placenta, it's also why nurses monitor the baby's heart rate so closely for any changes. After the placenta is delivered, the 4th stage begins. This is a critical recovery period that we often call the golden hour. The focus here shifts to assessing for hemorrhage, making sure the uterus is firm, and then initiating family bonding and promoting that immediate skin-to-skin contact between parent and baby. It's a really special time. You know, this entire process is just a marvel of biology, this perfectly orchestrated dance of hormones and mechanics. But it really leaves us with this question about that powerful intersection of clinical skill and just profoundly human connection. Because in the end, the journey of labor isn't just about bringing a new life into the world. It's about the incredible strength of the human body and the transformative power of connection.